Sounds like a plan, and just want to, say up front, a lot of respect for you and Dr. Kiltz for and the team that's putting this together. I think this is amazing. And just knowing that people are out there trying to, add to their ability to help people. So big fan of that, and want to thank everybody here. And I think some of you know who I am, some may not, but I'm a family doctor in Chicago, and my training includes obesity medicine. I just had an obesity clinic moments before I came to this call, and I have a master's in nutrition and functional medicine. Inspired by Dr. Paul Saladino, I remember seeing him on one of those doctor programs, and someone said to him, "How dare you talk about nutrition? You're a doctor." How ironic is that, right? So I said, you know what? They'll never say that to me. So I purposely got that training just literally for moments like that. I think you can learn just as much from YouTube and Google, to be honest, compared to medical school. So I want to thank you guys for being here, and we'll kind of walk through the slides and just talk about some of the things I think that are important for you guys to be thinking about as you are entering this world of coaching. And I think how you look at disease is important, because if you frame it through a certain lens, then the people you coach will see it through a similar lens. And the main thing that is important for our patients, our clients to understand is we're not about disease management. And you could argue type 1, you have to manage that, but we're more about disease reversal. And that's why we started the American Diabetes Society with Dr. Kim Barrick, Dr. Eric Westman, Ben Bickman, et cetera. We started these things because we wanted to be able to say to the world that if it's not about reversal, then what are we doing? So I just really think that's important, that as you message that, and in your role, it's going to be really important that we say that out loud. And when you look at this, it's like, well, why does it matter? And as we introduce this topic, we want to introduce Maria, and imagine her being someone with type 2 diabetes 12 years ago and very, very interested in not having that anymore. But she was doing all the so-called right things. She was doing what everybody tells her to do: count calories, exercise, but she felt stuck. And by being stuck, she did know about metabolic health. So if I have a conversation with her and in this setting, I would say to her, it's all about metabolic health. So you got to get those carbs off the plate. And by doing that, she was able to reverse her type 2 diabetes within about 6 months. So no more medication, no more gimmicks, just root cause healing, the type of healing I think that will really lead to you inspiring a lot of people like Maria every single day. And you're really in a very unique position, because we still live in a world where we're all unicorns. Because if you go to my clinic, where we have 50 doctors in that clinic, and I lead that clinic, they're mostly still in the old paradigm. They still believe that everybody should be on the statin. They still believe that diabetes type 2 is a chronic health condition that can't be reversed. And they still don't recognize the value of lifestyle change. And that's why they don't value you yet. And if I were to say what's the biggest lever I can pull to help patients heal, it's not just telling them about what to eat. It's about saying to them, you need a coach, because 80% of their success is going to be based on being able to stay on course. And that's going to require a team effort. So metabolic health, as you know, I call myself the metabolic health doc, because it's a very easy way to address a lot of things by doing just one thing. And that's obviously changing your lifestyle to improve metabolic health. So you've heard the stats, 1 in, 12 Americans are metabolically healthy, meaning that most people that you interact with in your family, at work, at play, they're not metabolically healthy. That's because they don't meet these 5 basic markers of metabolic health. Their waist size is too large, blood pressure is too high, triglycerides are too high, their good cholesterol is too low, and their fasting blood sugar is too high. They're not just numbers. They're predictors of how long you live and how well you live. So another term that we will put in front of our clients is health span, and we want our lifespan and health span to match, right? So, and if we do a really good job as coaches, as doctors, we help improve every one of these markers that are listed on this slide. So if if you have a client in front of you and they need to know where the research was done more recently, I think University of North Carolina did the study that was done earlier, maybe in 2018. And that's when they said 1 in 8 people. But then they did the new study and showed that even less people are metabolically healthy. So it's really important that we have data to show to people that, you know what, we're going to put you in that 7% who are metabolically healthy. So here's the domino effect. And when that first domino fall, and let's just say that first domino is a high blood sugar, right? Then the rest follow. And obviously, if I have a high blood sugar, it's going to raise my insulin. And I tell my patients all the time, your blood pressure is a sugar problem, because if my sugar is high, it's going to affect the blood vessel. It's not a salt problem. Salt is one of the contributors, but if I have blood vessels that are not stiff, I'm going to just open them up. So if I eat a whole lot of salt, I'm just going to eat a whole lot of salt, maybe hold on to more water in my blood vessels, but it's not going to affect me like it's going to affect a person who has insulin resistance. But you also know that not only is high insulin going to increase the blood pressure, it's going to increase the belly fat, because we know insulin is the fat storage hormone. We also know our triglyceride is going to go up, our HDL is going to go down, and ultimately we're going to end up with all of these chronic health conditions like heart disease and dementia. So the goal is to help the clients we work with to put that first domino upright so it won't knock down the others. And if we do that, we will put them in a stable position so they won't be negatively affected. And it's really important to share that. Now, why is it so important to deal with this high insulin and not have this high glucose life that occurs with type 2 diabetes? Diabetes is like the tip of the iceberg. That's what you can see. But ultimately, when things fall apart, here you go. You see all of the things that you see on this slide. Now, my wife's dad just passed away. I've done videos with him about 5 months ago. I think it was in March or so, maybe February. And he had type 3 diabetes, dementia. Now, when you take a guy who was the guy who led his family, yellow freight truck driver, and then you see what he became, you don't want to see that happen to anybody else. You don't want to see anybody. I bring him into the bathroom. I did a lot to help bathe him and things like that. And I would say, maybe you should try to urinate right now. And he would look at the toilet and not even know what it's used for. Nobody should end what was a great life the way he ended it. And we gave him as much dignity as we could. But type 3 diabetes is another way to say dementia is another way to tell you that sugar is a problem for the brain. It's also a problem for the brain, leading to increased risk for stroke. And if you really were to start at the top of it, think about diabetes. If you think about it as a blood vessel disease and you start at the top, you got dementia, you got stroke, you look at your eyes. Everybody on this call knows that the number one cause of blindness is diabetes. It's a blood vessel disease. Everybody on this call knows that dialysis, the number one cause is diabetes. It's a blood vessel disease in the kidneys. Everybody on this call knows that your risk for heart attack is super high, so blood vessels of the heart. Everybody on this call knows that erectile dysfunction is a blood vessel disease. Diabetes makes that worse. Oh, by the way, everybody knows that the number one cause of amputations is diabetes. So if you fix one thing, you fix a whole lot of things. So when you're talking to your client, say, guess what? I have a solution. In fact, what I do it tricky. You gotta be tricky. And what you say is, what type of medical conditions scare you, right? And say that to them. Say, what scares you? What has harmed your family? No matter what they say, it's going to be one of these metabolic conditions, right? And so if I can help you not have that because your mom and dad had it or any other family member, wouldn't it be nice to know you can do one thing to fix all of that? And that's what's beautiful about this conversation. It's a diabetes conversation, but it's so much more. Now, when you look at the bottom there, you'll see use the resource share for the top 50 conditions that improve with keto. I actually did a video about that, and I'll make sure to share that. But that list, that document, is going to help you know that there are 50 plus conditions where we have evidence, randomized trials to utilize. So that'll be part of your packet. But the metabolic multiplier and I probably should have put it in Nutrition Network. They both have search engines. So Metabolic Multiplier has a search engine, the Zotero search engine, and then the Nutrition Network has one. What you need that for is for that. So some people will come in front of you and they'll say, they'll just trust you and believe you. Other people are going to be cautious and want to know more. So if I have a person in front of me who has lupus and I say keto helps lupus, then I need to be able to show them the studies. And that's what those search engines will do for you. So I encourage you to have that in your toolkit. Now, if you had my title listed on the screen, you would see all these letters behind it, master's and all that stuff. But one of the things I have is an MBA. And when I got my master's of business, because my wife said I'm a professional student, and I figure if my health system, which is Advocate Health, is going to give me some money to go to school, I'm going to school. So I'm not doing it anymore, just an FYI. But so I took their money and got an MBA because I knew I was a healthcare leader, and I thought that would be helpful for my resume, right? And help me lead. And, reversing diabetes, again, doesn't just start with saving lives. It's about restoring life. So what's the return on investment? So just by changing your diet, we're taking less medicine. Our clients are going to have more energy. You're going to have healthier relationships because the up and down sugar is going to change your mood. You're going to be irritable. You're not going to want to engage. You're not going to be able to focus if you're chasing high sugars and low sugars. So there's more time that we can be the best version of ourselves and be present for the people in our lives. The good thing about this lifestyle is that it's cheap. It's cheap to fast and it's cheap to eat a low carb, keto, or carnivore diet because all those dietary patterns satiate you. So you don't have to spend a ton of money on food. You're not wasting food. And of course, you save a ton of money on the cost of drugs because you're going to be getting those drugs removed. So it's just going to be a nice opportunity for people to be in a position to do all of those things. Now, this slide talks about, your role is so essential. And again, I said earlier that 80% of the success is based on coaching. This is not like some random thing I came up with. It's something that Virta Health, VIRTA, you've probably heard of them, that does research. They would tell you that. Clinicians like Dr. Tro Kalajian, who also helps people with this type of work, he would say that the coaching, the apps they use are the most important thing. So you may not wear a white coat or scrubs like I have on right now, but your influence will be immense. You're going to help, people apply what we recommend as doctors, certainly what we're recommending in this community. So you're going to be the encourager, the educator, the habit builder, because you're going to be guiding people to metabolic health, one meal, one walk, one decision at a time. So it's really important you understand your value because again, I can't be there in a way that you will. And what I find is that when I work with coaches and or even a nurse navigator, people who can spend more time with the patients, they know more about the patients than me. And they then are able to identify what needs to be solved for. So just a quick thing about insulin, as you know, is the body's fat storage hormone. And type 2 diabetics in particular live in a state of chronic high insulin. And because of that, they struggle with their weight because fat gets kind of locked away. And I have a friend from college who is not at her ideal body weight, and she runs marathon and she can't lose weight. Now, how do you run a marathon and not lose all the weight you want? It still shocks me. But unfortunately, she does not have the dietary pattern that we'll be, sharing with people doing this work. And because she doesn't have that dietary pattern, you can't out exercise a bad diet. And I just think that her carb consumption is so high that it hasn't allowed for her to lose weight. So so again, it's not just about lowering insulin. It's about, lowering sugar is about lowering insulin. Insulin is a way bigger issue than sugar because there's other things that raise your insulin level, as you know, stress, lack of sleep, etc. So it's important that we keep that in mind. Too much insulin, inflammation, insulin resistance, and all of the downstream effects that occur because of that. So let's quickly go over that again. And this is important. So you're not playing clinician, but I think it's important you tell your clients this. You need to get a fasting insulin level. And the reason why And even if it's out of pocket, even if they go to own your own labs with not doctor, but Dave
David
Feldman.
Feldman.
Thank you. You want to have access to this information because, again, and we try to get that number from 10, 10 or lower, or certainly lower than what it was. But hyperinsulin states will damage you. And you can know in, 5 to 10 years in not in advance, not only if you're going to get diabetes, but if you're going to be at risk for heart disease. Now, just to put that in perspective, one of the videos I did, I think it was a cholesterol video. And I think that's what, so if you type Dr. Tony Hampton cholesterol, one of the videos says something like LDL is a poor predictor of heart disease. So if you ever want to look at that video, but one of the things I said in that video is that if you use cholesterol and LDL cholesterol as the foundation, your fasting insulin is 6.7 times more predictive of a future heart attack than the cholesterol and the LDL. Oh, by the way, and this doesn't surprise you, your blood pressure is twice as a better predictor of a future heart attack compared to the cholesterol and LDL. That's why it's one of the metabolic markers. So with that information in hand, the average client in front of you will be incentivized because you're trying to look for hooks. And the hook is, how do I get people to follow through with this dietary pattern? Well, if you check their insulin level and it's like 50, 60, 70 or beyond, they already know their risk is super high for bad things. So I would encourage them through their own, resources or through their doctor, if the doctor will get that level to do that. So we're trying to avoid hyperinsulinemia. Now, we mentioned the term insulin resistance as well. So when cells stop responding to insulin, the sugar will build up in the blood. But there's more. When that occurs, now inflammation goes crazy. Now, the average doctor will say, don't worry about the inflammation. I'll just give you a statin. And it is true that statins do reduce inflammation. Oh, but it also increases your risk for diabetes by 68%. Oh, it also increases your risk for cognitive decline. Imagine having a wife with type 1 diabetes who has a 0.5 triglyceride to HDL ratio. So it's really good. It's less than 2. Who has a 0 calcium score, and you know what the doctors want to do. They still want to put her on a statin. But her dad has dementia. So her risk for dementia, in theory, genetically may be higher. But the doctors still want to put her on a statin because it's going to reduce inflammation. They don't appreciate, which is what you appreciate, that the lifestyle is more powerful than the statin. And it doesn't have all the side effects. Oh, by the way, if I have insulin resistance, now my blood pressure rises. Well, they'll give you medicine for that too. Instead of focusing on lifestyle. Oh, by the way, if I have inflammation and insulin resistance, my cholesterol is worse. Well, maybe, but the reality is your diet will do a better job because most cholesterol issues are related to damaging blood vessels and your body's trying to repair the damage. My house is this is a brick house. It's a Georgian house. And I don't want to stucco my Georgian house. But if I have cholesterol, LDL cholesterol is the mortar that'll tuck point my Georgian house. But if I'm inflamed, I'm having a big party in the house because of the sugar and starch I eat, then my cholesterol is going to say, hey, let's put more cholesterol on that. And instead of tuck pointing, it's going to stucco my house. And that's what happens to the arteries. Cholesterol so diabetes, because of all that inflammation from that sugar, is causing cholesterol to over respond. But it's like blaming a fire truck when you have a fire. We need to stop blaming the fire truck. We need to start asking, why is the house on fire? And that's what'll happen when you understand metabolic health, which is what you guys are doing. And by the way, if I'm insulin resistant, I'm tired, I'm just not feeling good, because insulin resistance means the blood sugar that I should be using for fuel is not being utilized. I'm just urinating it out. I'm drinking water because I'm always thirsty. I'm always hungry because I'm not getting my fuel. So if I have all this sugar in my blood and I have insulin resistance and I can't get that into my body, I got to get it out of my body because sugar floating around is dangerous. We only have 1 teaspoon of sugar in our body typically. Anything beyond that, our body tries to store it as fat or get rid of it, or store it as glycogen. So the key is to understand insulin resistance is a problem, and it can be reversed by getting rid of the thing that led to it, which is excessive carbs in many cases. Now, this slide is not correct, but it does the job because it doesn't have anything on it. But you already know what's to the left. It's carbs. And then in the middle is protein, and to the right is fat. So you already knew it was on the slide, so maybe that was done on purpose. So the whole point of it is we need to understand that carbs are the biggest culprit. Protein spikes it a little, and fat barely moves the needle. That's why we promote low carb, keto, and carnivore diets, because we reduce the one thing that reduces the insulin spikes. And your body doesn't like insulin spikes. And so we tried to avoid that. Now, what about dietary patterns? Literally on my way to this conversation, I did a telephone visit in my car. And this was a plant-based patient of mine. And during that call, she told me a few things. I think I even had some notes about it, but she was having, her nails were starting to separate. She was vegan. She had some issues with hemorrhoids, and she had one other issue. And I thought in my brain, she's not getting enough protein, probably. I thought in my brain that her zinc level may be off. I thought in my brain that her B vitamins may be off, biotin, etc. Because when you go on a plant-based diet, these are the things that can happen. You can absolutely do a plant-based diet, but you got to know so much. And on the south side of Chicago, I don't really think we have a community that can deal with the sophistication of a vegan diet and being able to combine the lentil with the right beans so you have a complete protein. There's just not a lot of complete proteins that are plant-based. You may do okay with tofu, things like spirulina. There's like a handful of things that are complete. And so, and she wasn't even, Dr. Nelson, she wasn't even taking a B12 vitamin. She didn't know. And she's a very smart girl. She's not your typical, like, less educated. She's like pretty smart, pretty educated, but she didn't know. Now, so this slide is to say to you, you have to meet people where they are. You cannot, in fact, one of my presentations, Doc and team, was, I speak at the Symposium for Metabolic Health next weekend, and I did a topic saying carnivores and vegans should live in harmony. If you ever want to hear that, just Keto Mojo has all of our lectures. So if you say Dr. Tony Hampton, Keto Mojo, you can listen to that lecture, because I refuse to live in a world where I demonize you because you're on the other side of the aisle. Rather you're Republican, Democrat. I don't work that way. I'm all about policy and what works, right? If something works, I'm for it. So carnivore works, keto works, low carb Mediterranean works, and low carb vegetarian can work. If you got a client in front of you who's doing plant-based, you respect it. You get a sense of what labs they may need to check on, things like zinc and magnesium and B12, anemia, thyroid, and then you respect that and say, let's try this and see if we can get you on track. And if we can't, would you be open to adding some seafood or something just to get you on track? That's a better angle than to say, we know right and you don't. We don't want to live in a world like that. Because guess what? You may have a client in front of you who is Hindu and they worship cows. So what you going to do with that client? Dr. Rashani Sanghani has a YouTube channel. She's in India, used to work for Advocate Health herself, and she gets people off medicine in India who are plant-based. So we know it can work. The diet doctor, if you just say diet doctor, vegan or vegetarian, they got resources, meal plans for people as well. But we still want it to be low carb because it's tough to lower your sugar when you're eating potatoes every day, right? Now, glycemic stability, right, is more important than glycemic average. Speaking in English, what I'm saying is, if you have blood sugars that are doing this, right, but your average is still a 7, we still have a problem. We want the average to be 7, but it's like you're not going up and down that much. Does that make sense? You want to make it where you're not up and down. Because every time you spike, you inflame, you are going to have cravings, because when it goes up, you need insulin to make it go down. So now that insulin is going to make it go down. Now you're going to have cravings. But if it's more stable, it's better. Your thinking is going to be off, because up and down sugars are going to affect your thinking process, and then your risk for heart disease. So we want to have stable, unlike that graph you see, stable blood sugars. And the only way you're going to get that is by not eating a high carb diet. Then you're chasing it with medicine and insulin and things like that. The other term that you're familiar with is glycation. When glucose sticks to protein in the body, there's glycation. That forms these advanced glycation end products. And again, just like that tuck pointing example, the cholesterol is trying to fix the, tuck point the house, but all of that sugar is causing damage. And that's why the cholesterol is trying to repair it. It's damaging your blood vessels. Oh, by the way, not just blood vessels that are all over your body, you got nerves all over your body. So now you have damaged nerves. And we talked about the kidneys and the eyes. It's like caramelized sugar coating your organs. The fewer carbs, the fewer of these AGEs. It's real simple. And these are the things our clients need to understand so they'll understand the damage. And one more reminder is that insulin resistance, it reduces nitric oxide. All your blood vessels make nitroglycerin naturally. That same nitroglycerin, nitric oxide that's in the medicine when people come in with chest pain, right? So, but if you are in a situation where you're insulin resistant, your body stops making the nitric oxide, which is going to cause your blood vessels to constrict. So people with diabetes who don't have it in good shape, they have all of this constriction going on. And did you not know, this is a stat that blew my mind, which is why doctors try to put everybody with diabetes on statins. If you have diabetes that's not in remission, your risk for a heart attack is equal to a person who's already had a heart attack. Think about that. And that's because of what you're seeing here, constriction. And we need to open up our arteries. Oh, by the way, you also have a lot of calcium coming into the blood vessels, which leads to more constriction. And eventually that constriction can, if it constricts in your brain, stroke. If it constricts in your heart attack. If it constricts for the guys in their private area, erectile dysfunction. So it's all the same disease. And we want to make sure we do everything within our power to prevent that. Now, I had to throw in type 1 diabetes because a lot of people think these dietary patterns are for type 2. And it is true that it's for type 2 for reversal purposes, right? And we know my wife, who has a pump and a continuous glucose meter, she needs insulin to survive. So I'm grateful that we have insulin, but we don't want her to be on that roller coaster. So we've lowered her carbs and we've lowered her insulin dose. In fact, just last night, I think it was, she keeps saying, I got all this extra insulin because she changes her, insulin supplies. And she's like, I got all this extra insulin. That's because she's not using it anymore. We used to go to Panera Bread and think we were eating healthy when we weren't cooking. And we've learned that all that bread wasn't good for her. So instead of having a 40 carb meal and trying to guess how much insulin she needs, imagine this. If you get, let's just say you're eating some Cheerios, or let's go to Raisin Bran, which is supposed to be good for you, right? Raisin Bran is about 46 carbs, right? Now, we know that if you divide that out, you're looking at, 12 teaspoons of sugar for Raisin Bran. Raisin, dried fruit is a problem, etc. Now, imagine you're trying to decide what a serving is. So if I put in front of my wife a serving of Raisin Bran in that big package, do I really know I'm giving her exactly what the package said? It's not like I'm really measuring it, right? So you're guessing. Now, another thing that makes this complicated is that 20% variation is allowed. So if I'm already guessing about how much I put in the bowl, oh, by the way, I can be off by 20% legally in the United States. So am I giving her 46 carbs, or is it 52? Or is it maybe 40? Well, I have to guess and give her enough insulin to match that. And it's not going to match even if the number is perfect, but it's definitely not going to match if the number's not. So what happens is my wife ends up hyperglycemic or hypo. Oh, by the way, if she has a lot of hypoglycemic episodes, her risk for dementia goes through the roof. Every time she has one, because you're killing brain cells. So for a person with type, them just like everybody else. And I want to say this. Let's go to the next slide. I got to say this. This is what got my wife to actually fall in line when it comes to the dietary pattern. Because she's from Mississippi. I don't know how many people are from the South, but if you go, I went to school in New Orleans. You try to find a healthy meal in New Orleans. I'll give you $100 right now if you find a healthy meal in New Orleans. It's not happening. It's a great place to go to have an indulgence because it's such a fun city and they fry everything in batter. Have your indulgence every once in a while. But it took a while to get her. But let me tell you what did it. When she saw this statistic, and you know where I learned this, Doc? I learned it from, I put her in Dr. Eric Westman's class on type 1 diabetes. And in that class, they said, what you see. They said, you know, the average A1C for a type 1 in the United States is 8.6, meaning their blood sugar is probably 180 or so on average. But they lose 12 years of life. Now, let's be clear. I'm a guy. I was born a guy before I was a doctor. So I don't have a problem with a 30-some-year-old woman. I'm not trying to be funny right now. But would I choose a new 30-something-year-old woman over a woman I've been with for 32 years, married? And we've probably been together 36. So I'm a guy. 30-year-old women look great, but do I really want a 30-year-old woman? No, I want somebody who's been with me for 32 years. And so for me, it's easy to be inspired because I'm not trying to give up. If I'm going to be with this woman who's my age, I'm not trying to give up 12 years. So I said to her, I even had to say, so I let Dr. Eric Westman, and once she saw that, she had no clue. And what makes me sick, which is why we created the American Diabetes Society, is that the American Diabetes Association is saying that a 7A1C is great. You're well managed. Never allow your clients to think that's okay. Because a 150 blood sugar will still lead to all the complications we've talked about. It's just going to take longer. So we're going to aim for normal. We're not going to tolerate abnormal, even for a type 1. Another resource I didn't share yet, besides the American Diabetes Association on this slide, is Dr. Keith Runyon. I think it's Runyun, I think. He wrote a book. If you type his name in Amazon and you have a client that has type 1 diabetes, he wrote a book for type 1 diabetics. And he, in a more simpler way, walked through in his book how to approach that. And he may have one episode when his sugar's off during the year, but he averages in the low 5s for his A1C. That's a good resource for a type 1. It's based on Dr. Bernstein's book. But as you know, Dr. Bernstein's book is a little thicker and a lot more to digest. So I want to say that out loud as well. Now let's go to the next slide, which talks about, why glycemic stability matters. Again, the up and down swings, I've kind of touched on this, but hypoglycemia causes mood swings, brain fog, and in some people, it can affect their consciousness, but certainly your risk for dementia goes up. Hyperglycemia, when it's fatigue, brain shrinkage can occur. Because if you have a lot of sugar floating around your brain gets overwhelmed, and it's like it just stopped letting the glucose in. And if you don't have ketones as fuel, your brain just starts to shrink. That's why people with dementia are associated with type 3 with diabetes, because you're not getting the fuel unless you go keto. And that's going to affect everything. Your quality of life is going to be affected. So we got to protect our brains. So here's some things to think about. We know carb counting is imprecise, but we still want to kind of deal with it. This kind of goes back to how I said, Raisin Bran is tough. We don't really know how many carbs are in a meal, so we just try to reduce the burden. So if she sits in front of a bacon, sausage, and eggs breakfast as opposed to Raisin Bran, not much to count. And it's easier for her to have the stability that she needs. Now, this is also true for type 2. So we have to be very careful about that. So let's talk a little bit about this coaching idea. So you're not really diagnosing and treating, but you're teaching and inspiring. You're helping to build habits that lead to reversal. You're bridging the gap between what people are learning and what they're doing. You're making things practical. And that's why you'll notice on my YouTube channel, I try to be as practical and simple as possible. I'll let Nick Norris get a little bit more scientific here, Dr. Ben Bickman, respect for both of them. But I try to keep my clients, my patients are very much needing to hear things on the 5th grade level. And so I think when you're dealing with people, see, if you deal with educated people, they can understand simple things. And obviously people less educated can. So let's stay simple. When you're coaching, keep it very simple. And here's an example of that. So this is what I tell people in clinic. It's so funny. People literally come see me and they're excited and we do our thing. And mostly it's they just want to be to a doctor that's not going to look at them funny, right? About keto and carnivore, for example. But it's also about, I just keep things simple. I say to my clients, listen, what animals do you like to eat? Are you willing not to put barbecue sauce, cornmeal, or flour on those animals? That's number one. Number two, what non-starchy vegetables do you like? And are you willing to do the same for those? We don't need all the sauces and flours and glazes and things like that. Of course, if they want to eat fruit. We talk about berries. Lemons and limes are fine. And most people in my clinical setting don't do grapefruit. Grapefruit is okay. But the problem with grapefruit, as you know, is it interacts with a lot of medicines. And then I say, well, let's come up with a target. There are different targets for carbs, right? And 50 is where you start to get into ketosis. We like to do total carb because net carbs are dangerous. Why are they dangerous? They work for some people, but not all. And you know, net carbs basically means carbs minus sugar, alcohols minus fiber. But if I eat 10 pieces of keto bread, which is 140 carbs, I could say, well, it's only 10 net carbs because I can subtract all the fiber. But everybody on this call knows that 10 pieces of keto bread is probably still not a good idea. So my goal is to keep people on total carbs if possible. Be flexible for those who are younger. Some people are younger and they can, like Joe looks a little young. I see you, Joe. So if you got a younger person who's athletic and doing some stuff, those people may be good with net carbs because we do want to be flexible. Now, Dr. Eric Westman would say, let's get the carbs down to 20 a day. In my clinic, I tell people 30 a day, but because if 50 carbs or less total, you're looking at about 70 to 80% of people will be fine. But if you want to really guarantee success, you probably want to be in the 20 to 30 range. I don't talk about carnivore as an initial idea, but people come to me talking about carnivore because they know I'm a carnivore. But it's not required that everybody become a carnivore. I needed carnivore because it fixed my irritable bowel better than keto and low carb, and definitely better than plant-based. So just be flexible and meet people where they are. We're just trying to create a metabolically healthy society, not, we're not trying to start a cult, the carnivore cult. We don't need that. We just need, my wife is ketovore. She's like Nisha Berry. She's a ketovore and she does just fine because she likes to eat plants sometimes. And if I have a moment of indulgence, I may do it too, but for the most part, I don't. So let's look at the next slide. So here you go, 50 carbs to start. If you want to be therapeutic, you may want to get to 20. And as you know, it's all about eating real food, plant-based or animal-based, outside of the grocery store where the meat and veggies are living. Avoid fruit for the most part, except for berries periodically. And, and we avoid the things that we know are harmful. And I always tell my patients, if it's in your house, it's in your mouth. We don't have Breyers in our a freezer. We have Oberweis, which is a place with ice cream. If we have a moment of indulgence, we'll go to Oberweis, but we're not bringing things into our house that we know are not serving us. And as you can see, juices and cereals, things like that don't really serve us. You can definitely find a way to make a low carb or keto smoothie, but you got to be careful because once you break it up, it becomes very sugary. So just be careful about that as well. I'm a very sensitive guy. I try to listen to people. I try to be compassionate. People are not going to necessarily change because of data. They change because they believe in you and you help them believe in themselves. You listened, you allowed them to ask questions. So you have to be curious, you trust them, listen to them, and they need to feel safe. That's what they need. And if you can bring that to the experience, again, not I know everything, but just that trust and empathy, they're going to love that. And it's also important that we are careful. We know a lot. You're learning a lot. You already know a lot because you probably came to this having learned a lot. So your goal is to find that one thing. For some people, it's that Pepsi. And if we can talk to them about that one thing that they're willing to do, sometimes you have to say, what's that one habit that you probably know is not best for you for diabetes that you're willing to change? And what's that one swap? Are you willing to swap breakfast cereal for some eggs instead? Are you willing to take a walk with your spouse after you have dinner? And then we celebrate and celebrate and celebrate all of these little wins. Doc, since the last time I saw you, we've been taking walks after dinner and it's been cool. And you say, you know what you guys talk about during those walks? And you reflect on it, make it even deeper. And that'll build momentum. And that's what you want to do because this is not like we're trying to get to the finish line quickly. We're just trying to move towards the finish line. And if we do that, we'll do fine. To the extent you can incorporate motivational interviewing into your conversations, that's going to be important. You're going to do a lot of asking, not telling. Say that one more time. A lot of asking, not telling. What would it feel like to have more energy. What would your doctor say if you came off one medicine? Now, I want you to let them dream, let them own that, and you're planting seeds, not pushing solutions. And as you can see from the slide, I won't go through each talking point. It's how you say things, like the first one. You should cut out sugar, as opposed to saying, what would it look like if you reduce sugar? Or what sugary food do you consume that you'd be willing to cut out? It's all about how you say it, and it's the tone that means everything. You can tolerate a cop coming up to me talking with dignity and respect is going to have a different kind of visceral response than one who doesn't. So the coaching mindset, the main thing is that's a nice little image. It looks kind of spooky. You're not the hero in this story. The person in front of you you're not Yoda. You're there to provide guidance on this metabolic mountain that you're there to support, encourage, and work beside them. But let them do the climbing. Let them. It's just like anybody that's been to therapy, and I've been to therapy, a lot of times they just listen and then they just guide the conversation, but you do all the talking. You're like, I'm paying for them to do all. It doesn't make sense, but that's how, but it does, it works. It works. I created this nest model, my podcast called Protecting Your Nest. These are pillars that allow you to heal. And what you're going to find is that some of your clients will struggle. They're trying to get off their diabetes meds. They're trying to do low carb or keto. And maybe some of them are actually doing the less than 50 or 30 or 20 carbs a day. But they're still struggling. And you're like, why are they struggling? That's when this nest comes up. And I got this from the roots of the functional medicine tree. There's a functional medicine tree that has roots, and what those roots do is they turn into the branches of the tree. But if the roots are not in good shape because you have poor nutrition, or you're not exercising, or you're not getting enough sleep, or you have too much stress, or your thinking is off, that can then lead to some leaves that start falling, or an unhealthy tree. So when you're in front of a patient who's struggling, start asking questions. Talk to me about your sleep. Talk to me about your stress. Maybe there's been some trauma in your life that you haven't recovered from. Those are the types of things that you want to talk about, because a lot of times when you start to peel that onion, this is what you're going to find. And of course, I came up with a rope to complete it to help us get up to the tree. And a lot of it is relationships. I've had patients who literally have spouses who didn't want them to heal or didn't want them to lose weight. They just didn't want it. Or in situations where they have exposure to mold, when you look about pollutants. Those are things that we need to know about. So when you start thinking about clients that are in front of you, maybe use this acronym to help you ask questions about things that could be sabotaging their success. So it's just something to use to guide you. So when clients have plateaus and their blood sugars are not going down, or their loss is not going down, you can start asking questions, and it helps to get to the root cause of why it's happening. If we don't deal with unaddressed stressors or trauma or some type of exposure, it's like pouring water in a pail with a hole in it. It's just not going to fill up. So use this as guidance to start to ask the right questions, because your job as a coach is not just to inspire, but to problem solve. And here's more, it's just a little bit more of what we just said. And I have found tremendous value in doing this. And it's really helpful when people really appreciate you when you can help them through their struggles. So here's an example of a client with an A1C that was 9.2. This is for type 2. Metformin and insulin were there. And then with the lowered carb approach, sleep being prioritized and taking those walks, insulin was gone in 90 days. I've seen people get off insulin in a couple of weeks. 6 months in, the A1C was 5.4, down from that 9.2. This is not rare, guys. This is like normal. This is like everyday life in my clinic. So this is exactly what you're going to see as you help people. And then for type 1, an example, roller coaster blood sugars, did a similar thing, got the carbs down. Eventually, by doing that, everything got better and things got better. So these are the types of things that are possible. Hard to see the results at the bottom, but This is kind of what happened to my wife, and she got big eyes like that too, by the way. But this is what happened to my wife. She doesn't take as much insulin. She doesn't have those up and down sugars anymore. You can't see the bottom, the complete story, but everything just got better. So a few more things to consider. Obviously, when you're a coach, they expect you to show up. They expect you to be consistent. They expect you to ask great questions, to be kind, and to help them in their learning process. And you've heard Angela Mayalu say, people don't remember, they don't remember what you say, it's how you make them feel. I want you to hold on to that. It's how you make them feel. They need to feel safe. They need to be seen and supported. And our society right now is moving away from this, and we have to help society come back to that. And to me, that's what a good coach can do. They want to be seen. So here are some things that we could probably make 20 slides with this, but I just want you to start thinking about the types of things that people worry about. And one of them is this cholesterol fear, right? So your job is to have enough information in your toolkit so that when they ask that question, you can say, don't worry about that. Here's something you can ask your doctor to test for, maybe LDL particles, for example, apolipoprotein beta A ratio, for example. We talked about the insulin level. They even ask about carbs, as you can see to the bottom left. Don't I need carbs? And you still have nutrition professionals in 2025 who feel that if you don't have carbs, you are not going to be able to live. And that's why they insist on 45 carbs per meal with the American Diabetes Association. It's the craziest thing. They believe that they don't know about gluconeogenesis and how your protein and fat is converted to glucose on behalf of the liver. So your job is to have these talking points in your back pocket. And of course, some doctors still believe nutritional ketosis is the same as diabetic ketoacidosis. We already know they're completely different. And nobody on nutritional ketosis gets, the sickness of ketoacidosis unless they're on the medicines that make you urinate out sugar, which are things like Jardiance. And it is something called euglycemic ketoacidosis that can occur because of the medicine, not because of the diet. So that's something to keep in mind as well. So keep these little, talking points in your brain. Certainly when people say things like their doctor said keto is bad for them, you ask your clients to say, Doc, I hear you. Could you show the study that proves that? Because there is no study that proves that. And then you have this ideal of staying curious. You got, this ideal of you're learning today, but keep learning. I have to learn because I got those degrees, but I also have to learn because I put out a video almost every day. So I'm constantly having to review and learn so I can put the right information in front of my audience. I need you to do the same. And also show up in areas that you may. I just listened to Dr. Bobby Price, who's plant-based, because I saw a video title saying, the dangers of carnivore. So I just was curious what he had to say. He's a pretty smart guy, but sometimes they say crazy stuff. And it's important that you hear what people are saying. Just like politics, look at CNN one day, look at Fox News the next day, look at MSNBC the next day. Just see what they're saying, right? And then, but he said something very intriguing, which is why you want to keep learning. He said that you can't make a bowel movement if you don't eat fiber. Yeah, I grin too. Now, I'm a carnivore, and last time I checked, I'm still having bowel movements. But people make crazy statements. Now, if he had said that you may have better bowel movements, we can have a conversation about that. But don't say you can't have bowel movements. So we want people like Dr. Bobby Price to be in the world, but we don't want people to put out information that doesn't honor science and reality. So the world doesn't need more prescriptions, guys. It needs more guides, just like a vitamin D3. K2. We know the K2 helps to guide the calcium from your joints and your arteries into your bone. You guys are the vitamin K2s of the world. I just thought about that, by the way, Dr. Nelson. So we need to guide people to the right place. That's what we need. We need guides. We need mentors, metabolic missionaries to lead us with love to a better place. And that's what this is all about. So you notice that my conversation and my talk was not just straight up like just diabetes. It's really about how you think, because I think how you think is going to be more important than anything. So here's my little, checklist, understand where people are starting, understand their past. Sometimes the functional medicine model teaches us to think about the past. We have to understand from whence people came. We have to explain the value of this whole metabolic healing process. We have to understand that, some people are more metabolically ill than others, and they may take longer to heal, and they need to hear that from you. We talked about protein and non-starchy vegetables. Number 3, we talked about the nest, the nutrition, the exercise, the less stress, more sleep. All of those things will help them to think about other things that could impact how they're doing. And we talked about movement that's in that nest. You don't have to exercise to do well with diabetes, but if you have a little extra muscle, you have a place to store the extra glucose via glycogen. So why not move if it's just a walk after work? And then, of course, we need to track things and do a good job with that. So when you think about the client's role in this journey and yours, it's important that you have a why. Now, me saying yes to having a conversation with you guys via Dr. Nelson's invite is easy because it aligns with my purpose. So if something aligns with my purpose, I'm going to do it. And so I want you to do the same thing. When I go to San Diego next weekend, it's aligned with my purpose. When I talk to our health system tomorrow about bringing a white paper to the Kennedy administration about what we want to do for metabolic health, it's aligned with my purpose. So it's not even work to me anymore. I want you to do the same. And by doing that, you're going to be okay. So beyond the honeymoon phase, how do we keep people on track? And we do that by we walk with them and we help them figure out how to have new habits, make sure we put them in a safe place, which is why we don't bring food in the house like Briars when we don't. It shouldn't be in the house. And we have community like this, and we set goals together. And when we struggle, we say, oh, you actually celebrate struggle because you're about to learn something. I celebrate struggle. It's the craziest thing. And finally, we're at the end. We're throwing our hands in the air because they don't have to listen to me at least doing this lecture anymore. We'll just do some Q&A. But at the end of the day, it is a joy to know that what you see in this image is what you're going to see with your clients. A whole lot of celebrating and just being grateful for the change that has occurred. It's just a beautiful thing, and I see it every day. And I just want you guys to be able to do the same thing. So I really am grateful for the opportunity. Thank you, Dr. Nelson and the team, for inviting me. And let's continue the conversation.
Thank you, Dr. Hampton. Very good. This will be, of course, available for you to, when we have the Zoom call, to review. And I can add anything else. Everything was very good. I'll be in San Diego next week, by the way.
Oh, amen. I didn't know that, so that'll be great.
All right. I did not see who popped up first. Forgive me if
Maybe
I
Edmund?
take it out of.
Edward did.
I'm sorry?
Edward, I think carnivore dude.
Edmund, yeah.
Edmund.
So let's go ahead and take Edmund here.
Okay. My question was, at the beginning, you were talking about a couple of resources where you could search engines that you can use to help find the information you're looking for, and I just wanted to write those down. If you could.
Yeah, it's real easy. One will be the metabolic multiplier Zotoro. If you search metabolic multiplier Zotoro.
Zotoro?
Yeah, Zotero. And all you're doing is and if we get to the site, if it doesn't pop up directly on that site, when you go into the metabolic multiplier site, it'll give you a link. And then when you get to the Zotero search engine, you just type in a particular diagnosis, and then you'll be able to see if there's any keto studies. As you know, it's not a lot of carnivore studies yet, but that apply to a particular diagnosis. You can also do the same if you search nutrition network research. They have a research hub. If you search that, you should also be able to find a search engine that is based on diagnoses. So it's two reliable resources I think you'll find helpful.
So nutrition network and research?
Yeah, nutrition network research.
Okay.
Or studies. It may be under studies too.
Okay. Thank you.
No problem, Evan.
All right, Teresa.
So I just wanted to comment on the type 1 diabetic because I have type 1 diabetes for 42 years.
Mm.
And I have been always into nutrition since I was diagnosed. So I always tried to keep my A1C low, but 7 was what they told us. So I'm thrilled that you started that society or helped start that society. And I do follow it with Dr. Ken Berry on it. But I also had a why. And I realized that, I don't know, Dr. Nelson, you know my why, it was my eyes. So I suffered from a vitreous hemorrhage and lost my vision for 11 months in my right eye and sought out Dr. Wiedemann to do carnivore. And when I realized, she said, try it for 90 days. And I did, and nothing happened. My vision didn't change. I've been carnivore almost 3 years, but after 2 years of carnivore, my vision made an amazing change. And when I went to I saw a retina doctor every month. I have had 3 surgeries, 40 something injections in my right eye. And he could not believe it. He said, I was looking to halt the progress from carnivore, from the progression from diabetic retinopathy. And he could not believe that he actually saw healing. He said, I don't know what you're doing, because in the beginning, he was totally against me stopping my injections. And I stopped them last year. I said, you know what? To read an extra line or two is not worth it. But I stopped all the injections and I went to him in June and I had healing. So I'm a total believer of the carnivore diet doing healing. I can drive, I can see. I mean, that wasn't in my cards. I was spent every month waiting for another injection, which is not fun in your eyeball. So let me
Yeah.
tell you, that was not. So I totally think that telling people, like if you're coaching, like I'm really doing it more to get information for myself. I work full time. I don't know how much coaching I'll do. But I think like telling people that you did it for so many years one way, it's not going to change overnight. You just
That's
got
right.
to stick to it to see the progress.
That's right.
I
I
think
agree.
that's like a real
I'll
important thing.
I'll I'll
Thank
uh
you.
I'll share this real quick, and then I'll be right back. So I did this interview with Dr. Lisa Wiederman. I just pulled it up, and I just think people need to be aware they have people in the world who are eye doctors who have seen miracles work. And I'm gonna tell you something. I've seen people with things like glaucoma, and I've seen cataract stabilize. I've seen glaucoma get better. I've seen macular edema get better. I've seen retinopathy get better. And it's crazy. And you wouldn't even believe it. But so I just want to say that that's possible.
Yeah,
And I just appreciate your testimonial. By the
it
way,
is
one more
possible.
thing. So everybody, we know Dr. Bernstein passed away recently. I think he was
Right, recently.
92 or something like that, 92 or 93. So he had a full life. But we do want to just make sure people are type 1s are aware of Type 1 Grit Facebook group, which is a
And
great.
there's a doctor, I don't know if anybody knows this, Dr. Ryan Attar, and I
Mhm.
also consult with him as well.
Okay,
I've consulted with Dr. Atkins many, many years ago,
nice.
but Dr. Attar worked underneath Dr. Bernstein for a while. He trained with him,
All right.
and
How you spell his last name?
Attar.
Okay, cool. Just want to make sure. Okay, cool. I'll look it
Yeah,
up.
and he's in Connecticut. He's functional medical. He's carnivore. He's type 1 diabetic. He's also was a Marine himself, and that's where he found out he had type 1.
Okay.
And I consult with him. He's my A1C. I'm trying to bring it down. I run a little bit higher. I'm 5.6,
Mhm.
5.7. I'm trying to get down to those fives. Not
Right.
easy,
It's hard.
especially when you
Type
have
type
it
one
that
ain't no
long.
joke. Yeah, type one ain't no joke. My wife struggles, but I mean,
Yeah.
but like you, she's doing fine. And everybody else would laugh at you and say, "So you're saying that's not good enough?" But we're
Yeah.
just trying to
Right.
tighten it
But
up.
you
So,
got it right. You got to
all
keep
right. Well,
doing it.
thank you. I
Well,
appreciate you.
first of all, congratulations, because it's not easy to get to
No.
those levels of A1C, and we have a few type 1 diabetics in this class. I know. I don't know
I
them
know
all,
Amy from Type 1 Grit.
but one of the problems that we have, and I think this is pertinent because you might run into this type of thing when you're dealing with a diabetic patient, you're coaching. About 15, 20 years ago, can't remember even the name of the study, I should know it, but there was a sort of a landmark study that came out where they were trying to do intensive treatment on diabetic patients, but the intensity basically was more insulin, right? And they discovered that, yeah, you can lower the A1Cs with the insulin, but the end result was more mortality, more morbidity and mortality. So the conclusion was you don't do intensive treatments to lower A1C. As a result of that, the recommendations sort of increase. Oh, especially if you have older patients, it's okay to have them at 7, 8, or 9. Don't be so tight. And all that advice was pertinent and was correct for trying to lower those numbers with medication or insulin. However, that has been sort of misinterpreted, and some even endocrinologists nowadays might get someone that has a 5.6, is a type 1 diabetic, and is controlling it very well without using excessive amounts of insulin. Oh, no, you can't be. I had one not too long ago. You cannot have it like that. You need to have it over 7.
Absolutely. My endo tells me that.
Yeah.
That's crazy.
And that's because they are misinterpreting the application of this particular study. If you're getting to those levels by eliminating the carbohydrates, you're not at an increased risk of any mortality or morbidity, because we do know that certain numbers on the A1C corresponds to mortality and morbidity increasing. But so you might find the patient where the doctor is telling them, no, it's okay to be over 7, or it's okay to be at any level. The lower you can be, the best situation will be always, but not achieving that level with intensive medication treatment is key.
I'm going to share this real quick. I know I keep saying I'm going to do something quick, but if you look at this graph right here, it kind of speaks to what I talked about without the graph. So if you see hyperinsulinemia, right, you'll notice that leads to insulin resistance. And we mentioned in the lecture that it's going to lead to blocking of the endothelial nitric oxide, which leads to constriction. I mentioned calcium leading to vasoconstriction. And then you're holding on to salt. So we tell people to restrict the salt, but if you have hyperinsulinemia from overnutrition with carbs, you're going to now have problems with salt. Oh, by the way, the inflammation. We're going to have inflammation that then leads to the hypertension. But the reason why I'm showing this is because what they didn't understand is that if you do high dose insulin, rather from your diet, from stress, sleep, or from a freaking insulin shot, all of this is going to happen, which is then going to cause a heart attack. And that's what happened in the study. So they didn't understand that the root cause of the problem is excessive insulin. And they think that tight control is going to lead to heart disease because you're using the wrong tool. The tool should be lifestyle. So you won't have this high. And by the way, I do remember those studies, Doc, and I'm going to stop sharing. The study, there was multiple studies. One was called the Accord study.
Accord is the main one.
Yeah.
The Accord
And then
study
I think
is
there
the
was
main
an
one.
advanced study, and then they had a diabetes VA trial. So those studies you guys could look up. And you would think in 2025 they would have gone back and said, oh, it was the insulin. But they haven't done that. So the endocrinologists are still thinking old school. And that's why they are obsessed with, oh, you can't have it too low, your A1C, because that's dangerous. Well, not if you're using lifestyle as the tool.
It's not. And by the way, Dr. Hampton, last week's class was on hyperinsulinemia. All right. Thank you,
Thank you
Teresa.
so much, Teresa.
Thank you.
Let's see. Let's lower your hand. Get you out of here. Sharon, who was next? Because
I think Sharon is the way I see it. Yeah.
Okay. Yeah. Sometimes that order at the top, it's sort
It's
of
not accurate. Okay. Cool.
Yeah. Sometimes, like, just go ahead, Sharon.
Okay. Could you talk a little bit? Some of this is personal, but the more I talk about it with other people in the groups, it seems that it's common, and I kind of understand. Starting on keto, I've been carnivore a year and a half. Started on keto about 2 years prior to that. I have watched my fasting insulin increase. So it started as keto, it was like in the 4s, and then it has increased over time, and it's like 10.7 now. And I get the higher fasting blood glucose in the morning. I get that. I get the A1C. Mine is like 5.7 now. It dropped to 5.4. I get all that and red blood cells living longer. I don't understand the insulin piece of things.
Yeah.
I don't know if it's like that physiologic hyperinsulinemia. I don't know if it, I mean, I know there's other factors, whether it's stress or sleep or whatever. I seem to be under control with that, but I've connected with some other people, and where it drops off is the insulin, because theirs is coming down and mine's going up.
Right. You're like, yeah, you're an outlier. It's complicated. I'll start with one of the things we had to learn about from my wife was protein, make sure her protein situation was okay. So what we ended up doing for her is we have to treat her protein just like it's a carb, but just not as much. So we know when you eat protein, gluconeogenesis can then lead to glucose production. So the question is, uh, are you an effective processor of protein? Some people aren't. Some people just don't process it well. So that may be an issue, and that's one of the reasons why A1Cs may be a little higher in people who are doing keto or carnivore, because some people just don't process the protein as effectively. And then some people struggle with their, just their calories, or, we tell people eat till they're full, but that's not always true for everybody. Some people have to be cautious about that. Certainly, they have to also be cautious about like snacking. So fat bombs and keto friendly treats, you have to be careful with. So there is some of that as well. I did hear some of the experts like the Ben Bigmans of the world talk about some people, there is this physiological insulin resistance concept that's possible. It tends to be temporary, but there are some people who, when you're switching from fat fuel, from sugar fuel to fat fuel, they do have a little bit of a physiologic issue that's happening. But going back to my nest and rope, whenever people come to me with these types of issues, I say, did we optimize sleep yet? If you haven't, I would do that. I put blue light blocking glasses on at night. I I do the morning mood light thing, so I get the bright lights when my cortisol is up in the morning. So I get my circadian rhythm together. I make sure my sleep is good. If you search Dr. Tony Hampton sleep diet doctor, Dr. Tony Hampton stress diet doctor, there are some, I wrote a couple of articles that gives you, some things to think about, but I would optimize that sleep. I would optimize the stress just to see if there's anything else going on. A rare person has the MTHFR mutation, and when those things occur, they can affect your story. And then the only thing else that comes to mind is electrolytes. I know it sounds crazy, but if you're not getting enough salt in particular, that'll affect your stress hormones and stuff. So your aldosterone could be off, and you may want to do some testing of your, aldosterone, adrenals, and see what's going on with those as well. But I think about trying to get the low hanging fruit, optimize sleep and stress, and then you start thinking about these outliers that may explain, because you're an outlier. And when you become an outlier, you have to start doing additional testing. The problem you may face is that if you're not dealing with a metabolically trained doctor, they may not really know where to start. Sometimes you have to go to a functional medicine doctor, because just because you're doing the right diet doesn't mean that your specific situation doesn't require nuance and special testing. And what we don't want to do is ever say there's no reason. There's always a reason. The question is, are we working with people who can help us play detective? If you don't have a metabolically trained doctor, unlike myself in Illinois, where I can't remotely do a lot of stuff, I may start doing some virtual coaching type stuff. I just can't be a doctor. They have the other doctors out there who are, I know Dr. Sean Baker has his metabolic clinic thing going. So you may want to say, can I talk to a metabolically trained doctor, even virtually, just to consult and just start to problem solve? Because I think that's what's going to be required for you.
Yeah, sometimes it requires a little bit of a investigation and the nuances and making sure you're triggering your circadian rhythm correctly by being exposed to light as early as possible, and that has
I've
an
worked
effect on
very
the
hard at
sleep.
that.
Yeah.
Yeah,
So,
yeah, I'm sure.
I've
but
worked very hard at that.
just a comment about the rising A1C. My opinion, I don't
Go
even know
ahead.
if I'm gonna have a different opinion than Dr. Hampton right now, because I do not believe our red blood cells are living longer, and that's why that explains the rise on the A1C. Why? Because A1C is a reflection of glycated red blood cells, right? Glycation is damaged. It gums up the red blood cells and the epithelial. It's most of the damage, almost 100% of the damage related to diabetes, for example, is inside the vessels, right? And if glycated red blood cells are living longer, that doesn't make sense because those are more damaged than the rest. I think when it has to do with diet, and all these other factors that Dr. Hampton just mentioned about the quality of the sleep, the stress, and all these other things that may influence the blood sugar. I think on the diet part, you might be having too much protein for you, and you may find that switching to a little bit of higher fat, you don't have to make drastic changes, but a little bit more fat and less protein. And yeah, even fat will have an influence on blood sugars and insulin levels, by the way. And those with type 1 diabetes, which is a long life, once you have it, unfortunately, I don't know of many that have been able to get rid of it. But you're always struggling to find that sweet spot. And once you find it, then you lose it. Because the same meal, you can put all the same circumstances, and the same meal might have a different effect one day compared to another day. It will raise your blood sugar 30, 40 points higher on one occasion. Why? Well, it's a good question because I don't know the exact answer, but maybe stress level, maybe sleep that day, that could be other influences. Thank
And
you.
last thing, let me just add, make sure
Yes.
you don't just rely on one
Thank
marker.
you.
So
Thank
make sure
you.
you don't just rely on one marker. So if everything else is better, fasting insulin, HOMA IR, whatever, if everything else looks great, we don't know what normal labs are for carnivore yet.
Right.
So we're still just be mindful of that. But I
Right. My
think everything.
triglycerides are 37. So
Oh,
like,
amen. There you go.
Yeah.
That's
All
really
right.
good.
thank you.
I'm gonna cut it out at 5 officially for the replay of the Zoom call. 5:01 is not gonna be available. So let's try to
Yeah, let's get. I'll
do
try to
as
be
many
briefer
questions.
too, because I have to kind of. My wife's gonna be waiting for me, so I'm gonna try to. I'll probably have to get out of here at the hour, but let's go.
So Maureen, I will stay and answer questions after that, but the Zoom call is gonna be cut off at 5. Okay, I mean for the recording. Maureen, go ahead.
Yes, thank you, Dr. Hampton. That was a wonderful presentation. My question is more to do with like a how-to with consulting. How would you deal with a client who persistently self-sabotages?
And that's tough because the first thing is you're trying to understand. You're trying to answer that why question, right? And sometimes, so think about that functional medicine model. And what you do is you start to go backwards like a therapist would, and try to understand at what point in their life did they start having any kind of struggle. So I think the first thing is to try to go be a detective in terms of going backwards. And I think being a coach, you may have enough time to start peeling that onion. So the first thing is let's let's go do that. The other part is most people self-sabotage. It's actually a fear tactic. They're trying to protect themselves. And if I was let's just say I'm in a marriage and there was infidelity, I'm gonna try to protect myself. I don't want to have the harm that came from. So you have to ask in a very gentle way, what do you think might be scary about healing or getting better? Is there anything scary about that from your past or just in terms of how you're thinking? And then if you can get them, because you're trying to get them to solve the problem. One thing I do in leadership is I say, you name the problem, and you're asking them, you say, okay, what's the problem we're trying to solve today? How, what would you like to change about it? And then you say, how would you like to change? And then together, hopefully they'll come up with a plan. So you try to help them to be part of the problem solving process as opposed to you trying to solve the problem. That's kind of a coach philosophy in general. What's the problem? What would you like to change? How would you like to change it? And then let's work together. And then you become the accountability partner. And I think that'll help too. So it's challenging, but I believe most people who self-sabotage don't really want to self-sabotage. And then many times they don't really know that they're self-sabotage. Their brain is just wired to think the glass is half full. Somebody's out to get me. And let's be clear, there are people out there who have like medical conditions that literally are paranoid. And sometimes they are so paranoid they can't even get good advice from somebody. So I think that that's kind of the framing that comes to mind for this, but I know this is a very challenging situation, which is why we need coaches to kind of peel that onion, but that's what comes to mind.
Thank you. Lois?
Hey, Dr. Hampton, thank you very much for today. It was really good. My
No doubt.
question is about, we do a good job at documenting how we get to that disease state and get type 2 diabetes. And we talk about how we can reverse it. But the metabolism, and I'm speaking from personal experience because I was type 2 diabetic, and people always say to me, oh, but you can't eat, cake and ice cream and stuff like that. And I don't want to eat that way. But have you seen anything in your practice where people have been able to heal themselves to the point where, like right now, and we were just talking about protein and stuff like that. If I eat too much protein, my blood sugar is higher than I like it to be. If I eat too late at
Right.
night, my blood sugar is higher than I like it to be. So I have to be like really strict. I'm hoping my question makes sense, but
Dr. Hampton?
I think he froze.
Okay. So
Or I stumped him.
let
No, I didn't.
So
Oh, okay.
I always bring back this analogy. And I think that, yes, we're searching for the perfect way, but, there is damage already.
Yeah.
So it's pull out aluminum foil. It's nice, shiny, very straight. And then you crumple it up and you make it the tightest ball. And then pull that aluminum foil, try to straighten it. You'll probably be able to use it in some form. You'll probably be able to have it all sort of straight.
Oh, Dr. Hampton's back.
But
yeah, thanks.
There is no way that you're going to be able to have that aluminum foil completely straight again. And so I think there is some remaining damage that you might not be able to reverse. So
Dr. Head, did you hear my question, or when you
just say it? I lost it for a second. I was actually my power was low, but say it really quick. I think I
no
heard
problem.
most of it.
We basically, we do a good job at documenting how we get to that disease state, and we talk about how we can reverse it. As a former type 2 diabetic myself, I can't eat the way normal people eat or how I used to eat, and not that I want to, but even if I eat, too much protein too late at night, my blood sugar goes higher than I would like it to do. So have you seen any cases, and a lot of other doctors will throw out, oh, it takes 3 to 5 years to heal, stuff like that. Have you seen anything where people have been able to, smooth out the tinfoil?
I like that. And that's why I was like, why is he talking about tinfoil?
Yeah.
Okay, I missed that part.
Just quickly, I'll repeat it for you. When you pull out aluminum foil, it's nice and shiny and straight.
Amen.
You crumble it up. You have your damaged system. When you try to pull that into a straight sheet, it always gonna have wrinkles in there. So you can make it 95% better. It is probably impossible to make it 100% better. And that's the foil analogy in very short.
I like that analogy. So a couple of things. The first thing that comes to mind is, if I use myself as an example, I was solving for irritable bowel. And yes, when I went from low carb keto to carnivore, my belly is like very happy. But you'll also hear people in the carnivore community and the keto community say, well, man, when I go back to the things that I once tolerated but wasn't good for me, I can't tolerate it. It's worse. And I think part of that, from what my research says, that it's probably a microbiome shift, number one. So my gut microbiome is now designed for meat and chicken and fish and things like that. It's not designed for Brussels sprouts. So So when I stopped eating it completely, my body was like, whoa, I don't want that at all. So it's actually a bigger reaction than it was. And my research says that's probably a microbiome issue. But when it comes to like your metabolic health, yes, I think your metabolic flexibility improves substantially when you move towards this dietary pattern. You've healed and your body can tolerate a lot more. However, you're still more prone. Like if irritable bowel is an autoimmune disease, I'm still going to be a little risky, a higher risk for that to come back if I go back to that other lifestyle. And that's going to then make it more likely that it'll get me faster than a person who's never had that. So I think you're always at risk. If I have a day of indulgence and I eat not Dr. Kilt's ice cream, but the local place ice cream, I can tolerate it if I do it just one time for a day. If I do it multiple days in a row, forget it. So I think the short answer to your question is you're going to be in a much better place in general when you're dealing with your clients. They're going to be more metabolically healthy, but they're always going to probably be more likely, more prone to things not being ideal. And it's going to depend on how long they lived in that metabolic dysfunction body. So, and that's been my experience. But for the most part, I do see people kind of, it's just like yo-yo dieting, right? If you yo-yo diet, you're probably going to find yourself fatter. Because your body, your metabolism starts to get slower and slower every time you go on that roller coaster. So I think that we're always going to be at risk, but I've seen so much positive that I just let people know, rather you're doing diet change, rather you're taking GLP-1s or any other intervention, once you kind of take your foot off the gas pedal, it's likely that you're going to struggle. I do think that some metabolic damage that occurred over the years some of it is going to be permanent. You're just going to be way better off having made these lifestyle changes.
Thank you very much.
All right.
All right. Thank you, Lois. Stephanie.
Hello. It was brilliant. I loved the presentation. Really
Thanks,
good.
Steph. Thank you.
Oh, my camera's come back on. I've got two cameras. I'm in there twice. Anyway, I'm so confused. But right, Dr. Hampton, I would like to ask about fibroids, and maybe you can point me in the right direction because I know you won't be able to talk for long at the moment, but a lot of women have fibroids. I'm given to believe that it used to be something that affected Black women more, but now apparently 80% of all women will get fibroids before they're 50. I'm asking this question because I had fibroids and I was diagnosed with them in 2018, but I was told, don't worry, it's nothing to worry about, and they're likely to go away when you hit the menopause, which at the time was less than 10 years away. And I thought, okay, well, that's okay. Anyway, I was later diagnosed with stage 4 ovarian cancer. And so I really wonder, are fibroids really harmless, or do you think they're a sign that something's wrong hormonally or metabolically long before the cancer shows up?
Where are you from? Because you got a serious accent going.
I know, I have. But I'm from the UK, but you
There
couldn't
you
tell.
go. I
And I
figured my
live.
wife, she can imitate you. She does acting, so she can imitate all those voices. So I
Oh,
was thinking about her when you
right.
started talking. Yeah.
Okay.
Well, so I believe that, although I agree with you that fibroids affect everybody because we live in a metabolic society. So fibroids, like everything else, is all about inflammation. Going back to the blood vessels, and we live in an inflamed world where everybody is inflamed. So the young girl who has polycystic ovarian disease is the same person who's going to get fibroids, is the same person who's going to have irregular bleeding, is the same person who's going to have painful periods, is the same person who increases their risk for uterine cancer. So it's all inflammation. It's all the same disease. Why would Black women or women of color, no matter where they are in the world, have a higher risk? There's probably some mechanistic things, but on the south side of Chicago, they live in chronic stress. 70% of Black women on the south side of Chicago are single moms. They have food deserts. They have all of these environmental factors that create stress. Therefore, they're going to have more issues with fertility, things that Dr. Kills deals with is sex. So it's some genetic factors, but I think it's mostly environmental toxins, chronic stress, lack of sleep, things like that that lead to it. And therefore, if we fix people's metabolic health, you can't necessarily make fibroids disappear. They're like rocks sometimes, but you can keep them from growing. A great resource, a gynae doctor who lives in San Diego, where I'll probably see her when we go to the symposium, is Dr. Well,
Salcedo.
Dr. Salcedo. She also has a YouTube channel, and you may want to go to it. It's called The Conscious Gynecologist, and she only basically talks about women's health. So I would look into that. But when you look at her videos, I'm sure she has a video that specifically speaks to this, and that'll help you frame it through. It's a metabolic disease, 100%.
Mm.
And she's done lectures about this, and I think so if you have a person of color, the first question is, are they living, a lifestyle that makes them not necessarily stand out from their peers? And if they are, they may not have this problem, but if they're living a typical person of color, less resources, more stress, they're going to be prone to this. And I think that's the biggest trigger.
Thank you so much.
No problem. Thank you for the accent.
Erin, please. There we go.
There we go. My question is to go back and look at hypoglycemia and hypoglycemia in regards to fasting and cortisol management. I have primary adrenal insufficiency, and I use a blood glucose meter, a Libre, because there's a correlation between cortisol levels and blood sugar.
Mm-hmm.
It's kind of an experimental thing that my endocrinologist is doing primarily with her patients on an insulin pump repurposed for cortisol. And we're trying to come up with data. I'm wondering from the two of you, what kind of knowledge and data you have to share to help me guide other people with adrenal insufficiency in healthy blood sugar. Okay. And that may be too big of a question for right now.
Well, it's complicated because when you're helping somebody with adrenal stuff, it does get complicated because you have to, do a lot of labs and stuff like that. And we know the adrenals play such a huge role. I mean, aldosterone, as an example, is why the kidneys hold on to salt. And so our electrical balance has a lot to do with our adrenals. So I think the question is, how do you help a client, right? And I think that some of it is helping them acquire the right data to make better decisions. So part of that is, if I can get them on with a continuous glucose meter, that would be helpful, because I want to know, when is my glucose numbers going up or down? I would kind of want to know that information. I want to know how I wouldn't want to just know a fasting insulin or a HOMA IR. I want to know what her peptide is doing, just to get a sense of, is everything working properly? And I think I would even want to understand what her ketones are looking like. So she may be a good person who want to go to Keto Mojo and kind of look at ketones, because again, it's very complicated, and you want to know, how are the ketones and glucose working together? So and I think as a coach, you want to know enough about the adrenals to say to them, when should you worry? What symptoms? So I would review the symptoms of adrenal diagnoses, whether it's adrenal fatigue or any other condition, whether it's dizziness, weakness, confusion, or whatever, just to get a feel for, when should they be considered safe? When are they not safe? That way they can kind of know when they need to kind of help, work with their doctor to be safe. So it is a complicated discussion. The adrenals get a little tricky, but I think I would just start with helping them collect data. So let's collect more data so we can kind of monitor things and see where you stand, and then we can work together to figure out how to put something in front of your clinician to help you do better. Some certain vitamins help adrenals, like vitamin C and B and vitamin B5. That may be something to consider, but that's kind of where I would go. And then I would also make sure that their lifestyle supports their adrenals. As you know, the adrenals like sleep and circadian rhythm. So I would be more flexible with them in terms of fasting or over restricting, because adrenals, they get stressed, right? So if you overstress the adrenals, you may put them in a more harmful situation as opposed to a more helpful situation. So that's kind of how I would help out.
Yeah. So from my personal situation, I have zero adrenal function.
Oh, right.
There are two calcified little knots that show up on a DEXA scan.
Yeah, and she has a pump, which is an insulin pump, like she says, repurposed for her medication. And so it's a special circumstance. I want to thank.
It's a circle I walk in, so
yeah,
it's something I'm going to become more. I'd like to get some more proficiency, not only in my care, but in guiding others.
Okay. Thank you very much, everyone, for being here. I am going to stay. Dr. Hampton probably has to go. It's going to be 5 o'clock, and we're going to cut for the students that are going to watch this later. This is where we're going to cut. I know there was a question. I think it was Aaliyah who had her hand raised. So if she's still there, and Amy, we'll take that after 5. This will not be available for afterwards for review. But thank you, Dr. Hampton.
Yeah.
This was very, very good. And we'll see you next.
I'm glad my disconnection occurred not during the presentation, but thanks for the invite. And I'm really encouraged by this community. Again, everybody in this community has an impact. So please know that you matter, and you don't know how your wings are going to spread. Just like the butterfly effect, so our job is to just make people aware, and we're going to model first that this helps us heal, and then you can spread your wings, and I guarantee you they're going to keep seeking you because people want to heal. So thank you for all you're doing. Good luck, and I look forward to connecting. Check me out on YouTube if you get bored, but I'll be over there too.